Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about serum phosphorus. So you all know that the kidney function test sometimes include serum phosphorus also, and serum phosphorus is one of an important element in our body along with calcium that maintains the homeostasis. So the normal level of serum phosphorus would be anything from 2.5 to 4.5 milligram per deciliter for an adult, and when the level of phosphorus goes beyond 4.5 milligram per deciliter, it is called as hyperphosphatemia, and when it is below 2.5 milligram per deciliter, it is hypophosphatemia. So this phosphate is abundant in the body and it is important both intracellularly and extracellularly. So much of the phosphate, whatever is there inside, it is bound to the lipids. It forms the phospholipids which are required for the cell membrane and also for the bones and the teeth. So it is one of the important part of the bone maintenance. So this phosphorus, how it is distributed in the body, this is 85% of this phosphorus is bound to calcium and 15% is intracellular. So if you compare between phosphate and calcium, 99% of calcium is in the bone, whereas 85% of phosphates is in the bone. 15% of phosphate is in the soft tissue and 1% of calcium is in the soft tissue. So the net weight total in grams would be around 600 grams of phosphate and around 1000 grams of calcium. So what are the function of the phosphorus? Phosphorus is required to maintain the health of the bone as well as that of the teeth. So it is required for the strong bones as well as strong teeth. It helps to maintain our energy level, and how it does that? By the ATP. So ATP is the one which will help us to give energy, and ATP needs phosphorus. It forms a genetic material, the DNA and the RNA, the adenine, guanine, all needs this phosphorus. It helps to form the membrane of our cells, that is the phospholipids. It helps to keep the functions of the brain and the nerves healthy so that the integrity of the synapses is maintained and there is a healthy functioning of our nervous system. It also helps to maintain the normal acid base balance and it helps in delivery of the oxygen. The calcium and the phosphate regulation is maintained by the parathormone, the calcitonin and the vitamin D, which help in the bone resorption as well as the deposition. Remember, calcium and phosphorus, they have an inverse relationship. Whenever the calcium levels are decreased, the phosphorus levels will be increased, and when the calcium levels are increased, the phosphorus levels will be decreased. So there is an inverse ratio of calcium and phosphorus. So now let us discuss about hyperphosphatemia. So hyperphosphatemia is a condition wherein the level of phosphorus in the body, phosphates in the body, goes more than 4.5 milligram per deciliter. So what are the causes of this high serum phosphate? One is renal failure. Whenever the kidney fails, either because of diabetes or hypertension, the excretion of phosphate is impaired, and this causes increased phosphate levels in the serum. And this increased phosphate, what it will do? It will result in calcium phosphates and they get deposited in the soft tissues, etc. So kidney failure becomes one of the important cause for hyperphosphatemia. Second would be hypoparathyroidism. You all know that parathormone is a very important hormone to maintain the calcium and phosphorus metabolism. So suppose if the calcium level goes down, the parathormone is activated. So the parathormone will try to get more and more of calcium from the bones. That is, the bone resorption will start. It will activate the osteoclasts. It will try and increase the absorption of the calcium from the gut, and also it will decrease the excretion of the calcium from the kidney. So all this will lead to increased calcium, and calcium and phosphorus have an inverse relationship. So when the calcium absorption or the calcium excretion is reduced and calcium levels are more, phosphorus level are going to go down. So basically in hypoparathyroidism, what happens? There is low PTH. So whenever there is low PTH, there is increased phosphorus. So this phosphorus mainly happens because there is decreased excretion of phosphates from the kidneys. Similarly, in pseudo hypoparathyroidism, what happens? There is parathormone, but the receptors are not sensitive to this parathormone. So the action of parathormone is not there. So when the parathormone is not there, the calcium level goes down and the phosphorus level starts getting more. So this can also lead to hyperphosphatemia. So you all know that this phosphates, proteins, etc., they are concentrated more intracellularly compared to the extracellularly. So whenever there is a breakdown of the RBCs, the phosphates inside the cell will come out. So the level of phosphates are going to increase. Suppose if there is rhabdomyolysis, when the muscle cells are broken down, the phosphates inside the muscle cells are going to come out and the level of phosphates are going to increase. So hemolysis, rhabdomyolysis, all these can cause increased phosphate level. Next would be suppose if there is increased intake of phosphate in the milk, as it happens in the cow's milk, there is increased amount of phosphates. Whenever it is given to the neonates, the cow's milk, etc., the level of phosphates are going to increase. That is increased ingestion of the phosphates. So it could be renal failure, hypoparathyroidism or pseudo hypoparathyroidism, hemolysis, rhabdomyolysis, and increased intake of phosphates. So this could be endogenous, as I've told you, in tumor lysis syndrome, rhabdomyolysis, hemolysis, bowel infarction, acidosis, wherein the cells break, the phosphates which are inside come out and the serum level of phosphate increases. It could be exogenous. There is an intravenous phosphate therapy given. There is an oral phosphate intake of the increased intake of phosphate happening. There is phosphate enema being given, so the phosphate level can increase. Or there is decreased urinary excretion. Phosphates are not being able to be thrown out of the body. Like in case of renal failure, it could be because of diabetes, chronic kidney disease, hypertension, etc. Or in case of hypoparathyroidism, tumor calcinosis, biphosphonate therapy, magnesium deficiency, etc. So those are all the causes of hyperphosphatemia. So now how do we treat the case of hyperphosphatemia? So what happens is we will have to treat the cause. What is causing hyperphosphatemia? That has to be treated. Suppose if the patient is taking increased intake of phosphate, that has to be reduced. So there should be dietary restriction of phosphate. Sometimes phosphate binders are also given. So what are these phosphate binders? These are some medicines which are used to reduce the absorption of phosphates. And this is usually given during the meals and with the snacks. Usually for the chronic renal failure patients, this is given because they have this hyperphosphatemia. So these phosphate binders are given. So common phosphate binders would be your calcium carbonate, calcium acetate, aluminium hydroxide, etc. So whenever there is hyperphosphatemia, that is the level of serum phosphorus going more than 4.5 milligram per deciliter, you will have to assess the kidney function. How is the kidney function? Is it normal or it is decreased? Suppose you have a patient whose serum phosphate is more than 4.5 milligram per deciliter and his kidney function is normal. Then it could be a case of spurious hyperphosphatemia. So what is this spurious hyperphosphatemia? The patient actually will not have hyperphosphatemia, but because of the presence of increased proteins, increased bilirubin, increased lipid in his blood, that can interfere with the analysis, that can interfere with the analytical assays, and that can give a falsely elevated level of phosphates in the serum. So in such cases, spurious hyperphosphatemia, serum level will appear to be normal, but then the patient also will have such paraproteinemia, hyperbilirubinemia, hyperlipidemia, etc. And also the kidney functions will be normal. Suppose there is true hyperphosphatemia. That means in this case what happens is the patient is actually having increased phosphate level in his serum. Like if there is an insulin deficiency. So what this insulin will do, insulin will try to push this phosphates inside the cells. So when there is deficiency of insulin, the phosphates are not pushed inside. So the level of phosphates can be more extracellularly or in the serum. Whenever there is hypoparathyroidism or whenever there is magnesium deficiency, biphosphonates intake, all this can cause true hyperphosphatemia. So next is hyperphosphatemia along with decreased kidney function. So whenever the kidney function is reduced, either because of diabetes, chronic kidney diseases, hypertension, etc., kidney itself is damaged. There is a renal failure and then the phosphate levels are more and also the kidney function is impaired. If in case of excessive intake of phosphate also there could be kidney damage. Sometimes in rhabdomyolysis, hemolysis, etc. that can also lead to increased phosphate levels. So now what are the symptoms of hyperphosphatemia? So hyperphosphatemia as such will not have any immediate symptoms by itself. But hyperphosphatemia can remove the calcium from your bones. The increased phosphate can combine with the calcium and it can cause deposition of the calcium in the extracellular spaces in the soft tissues, etc. This can lead to symptoms. So mainly the symptoms of hyperphosphatemia are because of hypocalcemia. So the patient can have muscle cramps, muscle weakness, tiredness, etc. He can have brittle nails, brittle hair, dry skin, coarse skin. There might be hair fall. Patient can have memory problems. He can be hallucinating. He can be anxious. He can be depressed. He can be irritable. There can be impaired nervous function. So a patient can have tingling and numbness in the lips, tongue, finger, etc. If it is severe, then the patient can have convulsions, seizures, and also abnormal heartbeat, that is arrhythmia. So basically it would be because of low calcium rather than increased phosphate what symptoms we get in hyperphosphatemia. Uh, this was about increased phosphate level in the serum or hyperphosphatemia, the causes, the symptoms as well as the treatment and how do we work up a case of hyperphosphatemia. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.